Hey guys, I want to share with you a patient success story. This woman is a woman in her 60s. The reason for coming in is she was suffering with weight loss resistance, fatty liver disease, psoriasis, type 2 diabetes. She also noted that she was experiencing severe cramping in her legs almost every single day. She was on metformin to try to help her with insulin sensitivity, Victoza, which is basically a type 2 diabetes version of Ozempic to try to increase insulin production. She was also on Jardiance, which really tries to get the body to rid excess glucose through the kidneys. And even despite all those medications, you can see she was still type 2 diabetic, so then the doctors put her on 100 units of insulin every single day. And she was also on a statin drug, and you can see even being on a statin drug, her LDL was still at 157. Here's her blood work coming in, so you can see type 2 diabetic, super high insulin levels as well, and you can see high triglycerides, high LDL, and high C-reactive protein. Here's her new blood work. And this is after about 3.5 months of working with her. And you can see that her A1C significantly gone down, but even despite that, her insulin levels going down. She went from 100 units of insulin down to 20 units of insulin in about 3.5 months. You can also see that when you look at this, you can see that LDL, you can also see C-reactive protein and triglycerides all got better. Basically what's happening is she's requiring significantly less insulin, but she's still getting a better result when it comes to her blood sugars. And what that means is she's becoming a lot more insulin sensitive. And all of these things are starting to improve and change as well. Now, just to be fair, she still has a really long way to go. And there's still some things that we need to do, including introducing some high intensity, short duration exercise with her. But some of the things we did leading up to that point is we put her on a very low sugar diet. She avoid any kind of inflammatory triggers, avoiding any IgE and IgG food allergies. So we put her on berberine, we put her on gymnema in order to help with her blood sugars, coleus to help with her LDL conversion into pregnenolone, and also high potassium supplementation of around 300 milligrams per day. Interesting thing about potassium is when you have elevations of blood sugar, it actually causes potassium to move out from the cell into the blood, which can make you look like you have high potassium, but in reality you have very low potassium in the cell, which is one of the reasons why it can cause cramping. It's also interesting is when you're insulin resistant, insulin is also needed in order to drive potassium into the cell. And so if you're insulin resistant, you can't get potassium to where it needs to go, which is actually within the cell. One final note, this is an individualized plan for an individual patient based on individualized testing. You're not an algorithm, you're not a flow chart, you're a person. And that's why we do individualized testing. And that's why we always say, test, don't guess.